Hi guys, once again Ijaz Hidayat is with you with new talk and with new discussions, and today we have the session number 4 with question answer session number 4. So the question for today is, what is the standard protocol for using aprotinin drug during cardiopulmonary bypass, especially in a complex cases. So guys, let's try to understand what is aprotinin. Aprotinin is a protein-based drug which known as the BPTI. B mean bovine, P mean pancreatic, and T mean trypsin, I mean inhibitor. So actually the aprotinin is a bovine pancreatic trypsin inhibitors. Usually this drug is called anti-fibrinolytic drug, which help to reduce the bleeding during complex cardiopulmonary bypass procedures. So the way we use the aprotinin medicines, so usually, as I mentioned, that normally we are using this drug in a complex cases, like having the where there is chance of more bleeding and more complicated patients where we need a long bypass, and we the anti-fibrinolytic medications like aprotinin is used. So the protocol of using the aprotinin is, the first of all, from the anesthesia side, they give an initial test dose that patient is tolerating this medication or not. So the first initial test dose is like 1 mils, which is containing almost like a 10,000 kilo international units, and this 1 mils of the medications, like a 10,000 units international units, which was given within 10 minutes. Once they completed test dose of the aprotinin within 10 minutes, then they initiate with the loading dose, and loading dose is like a 200 mils, which is almost equivalent like a 2 million kilo international units, and this medication is given within like 30 minutes. So they set the rate like 400 mils per hour, so it's mean within 30 minutes almost like a 200 mils the aprotinin was given through the syringe pumps by the anesthesia team. And once they completed the loading dose, they start with the maintenance dose, and the maintenance dose is almost like a 25 to 50 mils per hour, and which was containing like a 250,000 to 500,000 kilo international units, and this maintenance dose run throughout the procedures. So now we'll talk about the pump heart lung machine. So normally this was recommended by the anesthesia that they give you the pump for the heart lung machine. They will give you a aprotinin medicines drug to be added through the heart lung machines, which was almost like 100 to 200 mils. So 200 to 200 mils, almost like a 1 to 2 million kilo international units, which we are adding prior to start the bypass procedure. So we added in our priming volume. And what are the safety measurements as a perfusionist we required to take care the safety measurement during the usages of the aprotinin on a heart lung machine, and what are the precautions as a perfusionist we have to take? So first of all, as you know, the aprotinin is a anti-fibrinolytic drug which reduces to the bleeding point in a complex procedures, where we, as our routine, we are using our monitoring our bleeding point through the test called the ACT, so activated clotting timer. So normally for the ACT we require two type of the reagents which we are using to test the ACT. So there is two type of reagents available in the markets. One is the choline and the other one is the saline. The study shows that by using the saline, by using the choline, the ACT level is with a so as you know that we are monitoring our the ACT with the so by using, as you know, that we are using the aprotinin, by using aprotinin on during the cardiopulmonary bypass, especially in the heart lung machines. So as you know, the aprotinin has an anticoagulant property. The slight activated ACT is reliable for monitoring anticoagulation in the presence of aprotinin, and where the choline is activated, the choline activated ACT does not reflect this effect of the aprotinin during his presence. So the message for the to monitoring the ACT, always keep your ACT more than 600 second and above throughout your cardiopulmonary bypass when you're using Aprotinin on the heart-lung machines. Hope it is clear. Have a nice and good day. Take care. Bye bye.